Okay.
Yes, it starts with the age of 14 till 20, 21, 22,
Don't you think
teenage
it's an alarming situation for our society or the people at 14-year-old
Yes, yes,
patients?
definitely. Sir, if I talk about children, they are not having just issues with their writing, with their reading, that the student or the child, they are not behaving properly. These are not the only problems children are having. They're also going through depression. Children have issues like they cannot sleep at night. They are having nightmares.
Yeah.
Some are not able to eat properly. What
They're
is the
having a
reason behind
mobile
it?
phone as well. It's a disease, actually.
Yes,
We can
definitely.
say that, actually.
Because it's important that we have a healthy routine overall, right? Exercise is not just yeah, you wake up early in the morning and
Actually,
then
ma'am,
there's no
they
more.
are just watching porn movies. They have a bad habits. They have a bad gathering, so it affects a lot. I think so. What do you say? What do you
Definitely,
think?
sir. Social media
Yeah,
and awareness and approach to these things, they
exactly.
are never for the children. They are never for the children.
Because everything is on a one click, right? This is the
Yes, yes,
main thing, actually.
definitely,
Okay, fine. Yeah,
definitely.
I got your point. Actually, okay. As a licensed clinical psychologist and student counselor at times, how do you approach counseling to address the unique needs and challenges of students? Can you share insight into your counseling philosophy?
Definitely, definitely, sir. As I said that I try to have a person-centered therapy. That my focus is on what is the basic purpose behind
Mm,
coming to the therapist.
mm,
Why are you here?
mm,
What are your goals? What
mm.
are you looking out of this?
Right,
And the most important question that I ask them, that when once we are done with the therapy, that takes about 45 minutes to
mm,
almost 60 minutes. Okay.
mm,
So when they are done with the session and when you leave the room, what
mm.
are you expecting out of it? What do
Oh,
you like? What do you look into this? How is this going to change you? Are you
mm,
looking to work on your emotions? Are you looking to work on your thoughts? Is it your behaviors? Is it
mm,
your relationship problems? Or you have,
mm.
what are you looking at? That's
Right,
the main initial questions that I ask my clients.
all
And
right.
once I have those goals, those needs, I
Mm,
try to, tailor strategies according to those needs.
right,
Because if I have the needs, it's very easy for me to work on the interventions. Because
okay.
if I don't know why are you here, right, and
Mm,
I'm making interventions or I'm making treatment plans that focuses on something else, there
right.
will be no outcome of it.
Mm,
Because I'm working, suppose they are here because they want me to work on their self-esteem. And
mm,
I'm making strategies that is focusing on, how to wake up early in the morning and how to not procrastinate. So obviously they are not interlinked. So I
mm.
have to make sure that I'm aware of their needs so that I can work on their interventions as well.
Okay, that's great.
I also have to make sure that
Sure.
whenever a client comes to me,
Mm,
the environment,
mm.
the environment that I provide them is non-judgmental. Because if I start judging them, then there will be no difference between me and the people outside the world.
Actually, this is
I
a
have to
raw
make
right
sure
of us.
that, I'm
We
being
judge the
very
people,
non-judgmental.
right? If we are a patient or not a patient, it's a
Yeah.
society dilemma that we judge the people
Yes, yes.
and we make that statement that he is not
We
a
are
good
just,
man.
we are
He